and will be recapitalised thereafter. This will hit some families harder than others. Take Permanent TSB, for example, a state-owned bank in which we have 75% shareholding. Someone with €250,000 of a mortgage, with 30 years remaining on its term, who takes a 6-month break will face an additional cost of more than €6,200. Tánaiste, that means that they will pay back all the capital as per their contract, all the interest, but also then be hit by a COVID penalty of €6,200, a state-owned bank, increasing the debt of an already financially vulnerable household. At the meeting on the 11th of May, this issue was raised. I've seen the minutes. At the meeting, the CEO of Bank of Ireland claimed that the charging of interest during these payment breaks was required by the regulator. The CEO of AIB, in which the state is a majority shareholder, claimed that if interest was not charged, loans would go into default. Neither of these claims are true. No regulator required the banks to charge additional interest on mortgage breaks taken because of COVID-19. The EBA guidelines published in April showed that for payment breaks to be given without interest being charged during the period break was acceptable. This is what allowed the Spanish government to adopt legislation in March that would allow those impacted by COVID-19 to avail of a mortgage payment break on their primary residence without incurring interest accruing. It's what allowed Belgium's government and banks to adopt measures that ensured no interest would accrue for low-income borrowers availing of a mortgage break. And KBC have implemented that in Belgium for those customers. So can I ask you, first of all, how do you respond to the fact that you and other senior ministers were misinformed by the retail banks and the Banking Payments Federation on the 11th of May? And secondly, and most importantly, what are you now going to do? Are you going to act in relation to this and stop the overcharging of interest on these vulnerable 80,000 customers?
Tánaiste, please.
Thanks. Thanks very much, Deputy, for raising this important matter, and thank you for your ongoing interest and ongoing work on behalf of consumers and bank customers. As the Deputy will be aware, and as the House will be aware, banks are offering mortgage holders and businesses loan breaks of between 3 to 6 months. That's very welcome. It gives people breathing space if they're struggling to pay their mortgage or struggling to pay their business loan as a consequence of the pandemic. And so far, 140,000 customers have availed of the payment break. Crucially, it means that the loan is not reclassified as a non-performing loan. That's important for the banks because it doesn't hit their capital. It's important for the customer as well because it doesn't affect their credit rating, and the mortgage can't be then sold on. So that's important too. Interest does accrue during the break period, that is correct. And you mentioned the meeting that I had with the banks, Taoiseach at the time, Pascal Donoghue, Minister of Finance at the time, and the bank CEOs were there. And that meeting was on the 11th of May. I haven't seen the minutes, but I was at the meeting, you weren't, and I know what did happen. And I have to say the banks never claimed that they couldn't waive interest for that period. They did say that it would be possible for them to waive interest for that period. The issue that they had was that somebody had to cover the cost of the payment break. And you know how it works. Banks borrow money, maybe borrow money on the markets for 10 years. They turn that into a 10-year loan or a 10-year mortgage. If that mortgage doesn't get paid back for 10.5 years or 11 years, there is an increased cost of borrowing for the banks. So there is an additional cost for the banks. The question is, who covers that cost? Does it come out of the bank's profits? Ideally, I think it should, but they have no profits this year and may not for a number of years because of what's happening to our economy. Should taxpayers cover that cost? I don't think so. I don't think that would be fair on taxpayers, many of whom don't even have a mortgage or a home or a business. Should that fall on mortgage holders who are up to date with their payments? I don't think so. So it has to fall somewhere, and that additional cost, at the moment at least, is falling on the customers who are availing of that payment break. But I was very, very blunt with the banks and very clear with them, and I sought an assurance from them that as a consequence of them extending these mortgages and them extending these loans, they should only be covering their own costs. I said to them it can't be acceptable that they get some sort of premium out of this, that they make some sort of additional profit out of this. And I said to them very clearly, I'm not sure if it's in the minutes or not, but I remember saying it, I said to them that if it turns out that you somehow make an additional profit out of this or an additional premium out of this, that you make somehow more money out of this than you would have if the loan had been paid back in time, that I would see that as serious as the scandal of the tracker mortgages, and that we would come down on them like a ton of bricks. And that is the fundamental thing that I need to find out over the next couple of weeks as Minister for Business and as Tánaiste, is if the banks are going to make any extra money out of this over what they would have made had those loans not been extended, because that's the fundamental point for me.
Tánaiste, the minutes are crystal clear. And it's not just Bank of Ireland. It's not just AIB. It's permanent TSB as well. Now, unless the minute taker at that meeting has completely inaccurately reflected what happened at that meeting, like the polar opposite, then there's a serious issue here. Because black and white, it is written down that Bank of Ireland told you that they needed to do this because of the regulator. AIB said the same thing. Permanent TSB said it was the best option because the loans would go into default and a credit issue would arise for the customer. Now, unless the minute taker was at a different meeting, then there's a serious issue. But more importantly is the naivety which you've just expressed there. Go to Permanent TSB's website. As I gave you an example, €250,000. If you have a loan of that amount for 30 years, you will pay back all of the capital, all of the interest that would accrue normally in your contract, but an additional €6,200 additional. That is the COVID penalty. Now, you trying to suggest to me that the delay of payment by 6 months is costing Permanent TSB €6,200. There is no country in Europe that is faced with such high penalties as a result of this payment break than Ireland because of the high level of interest rate. And you should do what the Spanish government did on the 30th of March, which was that they brought in legislation which I have given to your Minister for Finance, that would prevent the banks profiteering on the back of a pandemic where the economy was shut down and people, unfortunately, are unable to pay their mortgages at this time.
Thank you. Tánaiste, please.
Thanks very much, Deputy. We've had a look at what's being done in other countries around Europe, and the way you've presented it in interviews and so on doesn't tell the full story. Different countries are doing different things, but it's broadly in line with what's happening in Ireland. There are some hardship cases, for example, in Belgium where they're treating it differently, but it's not as you've presented it in the media, and you've been quite misleading in your comments in that regard. The fundamental point for me, I think the fundamental point for customers and people who have availed of a payment break is, are the banks going to make any extra money out of this? And if somehow they make extra money out of this, make some sort of COVID premium or COVID bonus for the banks, that is not acceptable, and we will deal with that. But that's what has to be worked out for sure, because that's what matters. But it does appear to me, and this is what was explained in the meeting, is that if a loan is issued for 10 years and it gets extended to 10.5 years or 11 years or whatever, there is an additional cost of finance, and somebody has to bear that additional cost of finance. And I don't think it should be the general community, whether it's customers or taxpayers. But if it's the case that the banks are making an extra profit out of this, that they're benefiting from this in some way, well, that would be a scandal in my view. And if that's the way it turns out, we will deal with
it. Thank you very much, Ceann Comhairle. Tánaiste, we live in a republic, and in a republic we cherish our most vulnerable the most, except, it seems, for people with intellectual disabilities in a post-COVID scenario where the health services are coming back. Inclusion Ireland have produced a report and analysis of a survey of all families and users, and the statistics are actually quite startling. Effectively, families are burnt out and service users are regressing totally. There's no date for return to services in the absolute vast majority of scenarios, and no respite, or little of it. Last night I went and met Philip. He's 29. I spoke with him at length. He told me about all his troubles. I spoke with his sister Lauren. They spent their days painting, driving into the retro cinema out in Leopardstown, where he's got VIP status. He's been there so often. Cooking, but he has regressed terribly. I spoke with Claire Hendrick, chair of Comona St John of God's in Glenageary, where it represents 500 families. Her daughter is Leah. She's 20. Leah wants a life again. Every day she is regressing because of the lack of day services. Life has no purpose for her. She's getting up every day to do nothing. It's devastating to watch. And most importantly, Zoom will never work for Leah. I spoke to Breda. Her son is 28, Dara, St Michael's House. She said, quote, "I'm on my last legs." John Clark, whose son Stephen is 20, says his health is deteriorating and he's developing habits that are regressing his health, and he believes he and thousands of others are part of a forgotten community. I spoke to Noreen Walsh about Padraig, her son, who believes that he's going inward and regressing totally, and Kathleen Clifford about her son Alan, and she really asks why the funding for day services has been taken away and been transferred into other services, and she feels it's discriminatory. Taoiseach, I don't make this in a political way. These people are our people. They deserve, under the Republic, to be treated with dignity and respect. They deserve to have their services brought back. They are the most vulnerable and they're regressing. We're opening pubs on the 20th of July. I look forward to going for a pint, I'm sure you do. But really, these service providers, by the next phase of reopening, deserve to know when their services are going to happen. Getting back to Philip, you've met Philip. You actually know one of his parents and actually know him quite well. He's watching now. He asked me to say the following. He asked me to ask you, and these are his words, not mine. Please ask, when can I get back to work? Please ask Leo, the boss, when I can see my friends again. I really want to know. Please answer.
Thank you, Deputy Kelly. Tánaiste.
Thanks, Deputy, for raising this important issue, and I think all of us in this House will have had many similar stories related to us by our constituents and many queries coming through our constituency offices which are very similar. As I think everyone in the House will appreciate, a lot of services, a lot of normal health services, normal education services, normal disability services had to be suspended or discontinued or curtailed during the pandemic period, and the government is working really hard to restore those services to what they should be and what they used to be, albeit within the health guidelines. And that includes getting the schools open and open in full at the end of August. It includes getting colleges back. It includes restoring normal health services, including health screening, but also normal health services, and includes getting services for people with disabilities back up and running. It is difficult. It's not always straightforward. It has to be done safely, has to be done in cooperation with staff and with the best medical advice. But I can absolutely assure you that this is a very high priority for government and for the line ministers in question, and we won't waste any time or tolerate any delay in getting those services back up and running as soon as possible.
I'm not going to turn this into a political issue. This is too sensitive. It was actually quite upsetting last night. I spent hours talking to people. I could have spent weeks. They are being let down. The families are off their feet. All the service providers, every one of them have regressed. The progress that they have made has stopped. In many cases, they now have new issues. I looked at the Minister's statement last night. In fairness, Alva Keneally and RT, the Morning Ireland, told a very good story on it. The Minister's statement was too bland. She's delighted that services will begin in August. There's no plan in most cases to begin any services in August. I'll tell you why. Because in order to do that, they're going to need more staff. The staff that have gone to residential care are going to have to come back to day services. We'll need way more staff. And the other thing is, we'll need a capital budget to change the buildings, or indeed purchase new buildings or take over new buildings in order to adhere to social distancing. So I want to ask very clearly, will we get dates by the 20th of July for every family, the thousands of families who are affected? Is there a capital budget in place to change all the buildings to make them fit for purpose to do these services? And finally, where are you going to get all the staff to ensure these services can commence again? And will those who are working in residential services be brought back in to provide the daycare services? Thank you.
Thanks, Deputy. I'm reluctant to give you a date, because if I give you a date, it's a date that I want to stand over. I think the worst thing you can do in a circumstance like this, other than failing to provide the service, is to give a date that then you can't deliver, and then you raise hopes and you let people down even more. And I don't want to do that today. But I can assure the House that this is a priority for the new ministers involved in education and in health and in disability. Works will have to be carried out to some buildings, and a capital budget will be provided for that. But even then, the work has to be done, and that will take time too. And also staff will need to be redeployed back to services, and in some cases new staff hired. And all of that is going to take a bit of time, and services won't all be restored at the same time and on the same day. In some places they may come back sooner than others. But I totally understand, appreciate and agree with the sentiments issued by the Deputy, that families are at their wits' end, that people who had been making good progress are now regressing, and that's something of enormous concern to all of us. And we're very keen to get those services back as soon as is possible.
Thank you. Tánaiste, now the co-leader of the Social Democrats, Deputy Shortall.
Thanks, Ceann Comhairle. Tánaiste, my question today relates to the availability of the flu vaccine and the adequacy of the supplies that we have now in place or secured for this coming season. It's extraordinary to think that last year more than 4,300 people were hospitalised with the seasonal flu. And that's actually more than the total number of people who have been hospitalised with COVID to date. While Ireland works to prevent a second wave of COVID, it's so important that we also put huge effort into ensuring that we reduce the impact of the flu in order to protect the capacity in our health services. So, as you know, currently, Minister Tánaiste, the capacity within our hospitals in terms of beds and staff is completely inadequate for normal times. On top of that, now we're faced with a situation where, as a result of the requirements on infection control and social distancing, it's estimated that between 25% and 50% of capacity of our public health service is going to be reduced. In addition to that, it's recommended that 20% of capacity be reserved in the event of a second wave of COVID, which is, quite likely at this point. Tánaiste, that amounts to 60% of inadequate capacity being taken out of the system, leaving a mere 40%. Now, for that reason, it is absolutely essential that huge emphasis is put on reducing the number of flu cases in the coming season. And we need to take a lot of steps to do that, to encourage wider uptake. I recognise that the Department of Health has announced an expansion of the free scheme for people at risk under 69 and for children between 2 and 12 years. And we know also that, as was the case last year, over 70s are entitled to it. So, in addition to that, we have to take steps to improve the uptake, particularly among those at risk groups, but also among healthcare workers. So for all of these reasons, it's essential that we have sufficient supplies of the flu vaccine. So Tánaiste, can you confirm the level of supply that's available for this season and the number of doses that this equates to? Secondly, what is the estimated increased demand arising from various factors in relation to a heightened awareness of the need for vaccination, but greater sense of, the importance of protecting one's own health and the need to avoid unnecessary hospitalisation? And the other point, of course, is in relation to last year, there was 1.1 million flu vaccines delivered in Ireland. Can you provide an assurance that there are sufficient numbers of the vaccines available to cope with the demand this year?
Thank you, Deputy. Tánaiste.
Thanks very much, Deputy, for raising this really important issue at a good time, because this is going to be really important as we head into the winter. And indeed, we're watching very closely what's happening in the Southern Hemisphere, where they're now entering the winter flu season, and we need to watch what happens there to inform what we do here. Everyone knows that the flu comes every winter. What a lot of people probably don't know is that every year somewhere between 500 and 1,500 lives are lost or shortened as a consequence of the flu. It tends to hit particularly badly in nursing homes and residential settings, particularly hits the elderly and the ill badly, and has an impact on our hospitals. And part of the reason for overcrowding, which is a year-round phenomenon, getting much worse in the winter, is because of the flu and seasonal illnesses such as that. So what we're planning this year for the winter of 2020-21 is a quantum leap in our response to flu, because we can do better in terms of suppressing the flu virus than we've done in previous years, even if there was no COVID. but the fact that we do have COVID now creates the possibility of a second wave happening at the same time as a bad flu season, which will be very serious indeed. So we need to act now to reduce the risk of that, and that involves making sure that as many over 70s and healthcare workers as possible have the vaccine this year, and also for the first time in a long time, perhaps even the first time ever in Ireland, extending it to children under 12 and extending it to more at-risk groups. So to answer the Deputy's question, the extension will permit all of those in at-risk groups aged from 6 months and above, as well as all healthcare workers, to avail of the vaccine free of charge. The extension will also provide access to children aged 2 to 12 years old inclusive, and that will be the nasal drop vaccine rather than the injection. The HSE has placed orders for 1.35 million doses of the quadrivalent influenza vaccine for the forthcoming winter, and this will be sufficient for a 90% uptake among at-risk groups, including healthcare workers, and that's a much higher uptake than we would have had in the past. In addition to those 1.35 million doses, 600,000 doses of the nasal drop vaccine for kids has also been ordered, and that would provide for a 75% uptake by children. Just to give the Deputy an indication of what the uptake was like in previous years, about 68.5% for people over 65. So we need to do much better than that. There needs to be a big campaign around this. For healthcare workers in hospitals, just over half, and in the community, less than half. And that's a really big problem. We're planning for an uptake by children of 75%. Typically in countries where they provide the flu vaccine to kids, it's around 50%, for example, in the UK, 20% in Finland. So we'll have enough to do better than any other country does. But we should aim to do better than any other country does, because this is a real risk in the next few months.
Shortall.
Thanks, Tánaiste. I welcome the fact that there is going to be a promotional campaign to improve the uptake, and that's especially important among healthcare workers, as you say. Now, you talk about a quantum leap, and that's very welcome. So can you just clarify the figures? Leaving aside the nasal doses, you're talking about 1.35 million. I understand last year it was between 1.1 and 1.2. It doesn't seem to cater for a significant increase in the numbers from last year. So I'd ask you again, what is the estimate of the demand for doses of the vaccine in the coming flu season? And you say that the HSE has placed orders. That's not quite the same as securing additional supplies. So can you assure us that sufficient supplies will be secured before the outbreak of the start of the flu season?
Thank you, Deputy. Tánaiste.
Thanks very much, Deputy. The figures I'm given here is 1.35 million doses of the quadrivalent vaccine, and that is sufficient for a 90% uptake among at-risk groups, including healthcare workers, and 600,000 for children aged 2 to 12, which is 75%. But I'll double-check those figures because.
What's the estimate?
Estimate of what? Sorry.
The estimate of the demand.
I don't know if there is an estimate for demand, but there's enough to provide for a 90% uptake.
Have the additional doses been secured?
No.
And are you confident that they will be secured? Can you provide an assurance that they'll be available before flu season?
The way it works, as the Deputy will know, the flu vaccine for the Northern Hemisphere is formulated based on what the flu looks like in the Southern Hemisphere, because it starts there and spreads to the Northern Hemisphere. So it may be the case, and I might be wrong, but I suspect in this case the vaccine has not yet been formulated, let alone produced. So it wouldn't be possible at this stage for us to have secured a vaccine that has not yet been produced. But we are aware that there will be increased demand for this this year, and other countries will be looking to get the vaccine too. And I am confident that we will be able to secure those doses. But you're right to raise the question because we need to make sure that we do.
Thank you, Tánaiste. The Leader of AN2, Deputy Peadar Tobin.
The measure of a country is how it values its vulnerable. And this can be ascertained, in my view, by how we treat the people who look after the most vulnerable. So older people in nursing homes have been treated abysmally during the lockdown. They've been treated as an afterthought. When decisions were made, they had disastrous consequences for those. As a result, Ireland has one of the highest rates of nursing home deaths in the world, and yet today there is absolutely no full commitment from this new government that there will be a full public investigation. Today, pubs and restaurants are open for business, but community facilities for people with disabilities are not open. Because of the lack of direction on social distancing, many people with disabilities have been at home since March, are unlikely to be able to use services until at least the end of August. And the childcare sector, which is charged for the development and care of the next generation of Irish people, is in chaos as we speak. This sector, as we know, has been under phenomenal pressure over the last number of years, with tens of thousands of people having to take to the streets. However, shockingly, I have information received from the sector itself that states that 180 providers have closed since the start of the pandemic. As many as 10% of childcare providers have shut down due to the lack of support. And these closures, Tánaiste, are accelerating. In the last week alone, it's been reported that 55 childcare providers have closed. My office spoke to providers twice on the phone yesterday, and between those two phone calls, another 3 providers had closed. And I've been told this morning that 7 childcare providers in Dublin have closed in the last 24 hours. The childcare sector is dying on its feet, Tánaiste, and yet the government is sitting on its hands. Now, I spoke to the Federation of Childcare Providers, and they're not just charging the Department of Children with willful neglect of the sector. They are accusing the Department of Children of gross mistreatment of childcare providers. The Federation of Childcare Providers informed me that they've actually set up a mental health team with 2 doctors to deal with the level of trauma and upset that has been caused to the members by the Department and the Minister. So what I'm simply asking the Tánaiste to do here today is to intervene urgently with regards to childcare services. Make sure that they have the necessary supports. Make sure that we don't see the closure of these services further in the next coming weeks. And make sure that there is a service for parents in the second half of this year. Good morning.
Thank you. Tánaiste.
Thanks, Debbie. Just in relation to your earlier remarks, I think we all need to be very careful and we all need to be very responsible in how we use international comparative data when it comes to COVID. And we all need to take what we see on websites like Worldometer for what they are, which is not a like-for-like comparison of country by country. Every country is at a different stage in this pandemic. Things look very different in Israel and Portugal today than they did a few months ago, and the same will apply to other parts of the world as well. Countries that thought they'd eliminated the virus, like New Zealand, now have new cases every single day, and of course countries count differently. One thing we always did in Ireland was to count cases in care homes from day one. Other countries didn't do that. We counted suspected cases even when there wasn't a laboratory test confirming that the patient had COVID. Other countries didn't do that. And we didn't discount people who had underlying conditions like other countries did. So if somebody had stage 4 cancer, was in a nursing home and was suspected of having COVID but didn't test positive for it, we counted that. Other countries wouldn't have. So I think you need to be responsible in the way you use language and data like that, because it's not responsible to misuse it. In relation to the issue of childcare, I think we're all aware that childcare facilities often close in the summer period in July and August, so this is different to September, October. We do want to make sure that the sector is fully up and running for September, October in order to meet demand. Data is being collected on reopenings, and that will be available from Tuesday the 7th of July. With a weekly update until early September. In a normal year, roughly 40% of childcare providers operate over the summer. 60% of the existing services have indicated that they will be reopening by September, and this portion may rise. The government has provided a reopening package of 75 million. That's been made available through the Department of Children and Youth Affairs, now the Department of Children, Disability and Equality, and other government supports for the sector running through June, July and August. Since reopening, 1,000 services have registered 11,876 children on the DCYA funded programmes, and registrations remain open up till the end of the programme year. There have been 717 applications for a reopening support payment, and that's of an approximate value of 3 million. An additional about 7 million in capital grants have been applied for.
Tobin.
Tánaiste, the number of deaths in the nursing homes in this country is absolutely shocking, and it's wrong. And I'm always amazed when the government is confronted with the figures that their answer is, we count those deaths better than any other country. Counting the deaths is not something to be proud of. Preventing them was the important issue there. The other issue that you mentioned, these closures in the childcare sector are complete closures. They're full-time closures. The grants that have been provided add up to about 2,500 for reopening. But these childcare providers are, they're dealing with overheads like electricity, insurance, rents. They're dealing with wages. They have less children coming in. They have less hours coming in. And most of the sole traders that are operating in this sector are working 70 hours a week under an avalanche of administration, and yet they're not getting an income at all. Their debts are building up at a rate never seen before, and no level of future trading is going to get them out of this debt level. This is a crisis not like any other summer. It needs a response that is different. We had the previous Minister for Children who stated that there will be €750 million given to this sector. That money has not materialised to that sector. Key stakeholders have been locked out of decision-making with the departments. There needs to be a complete injection, a lifeline into the childcare sector now to protect it.
Thank you, Deputy. Tánaiste to conclude.
Thanks very much, Deputy. I was involved in the country's response to COVID from day one. I was at all the meetings where the big decisions were made, and I can assure everyone in this House that our overriding concern always was to reduce the number of people who got infected and to reduce and minimise the number of deaths in all settings, community, care homes and in hospitals. And we know now from the data produced by HICWA on excess deaths that we overestimated significantly the number of deaths in Ireland compared to when you use the excess debt measure. And the reason why we counted the way we did was we thought it was the right thing to do in terms of saving lives to overcount, because we were then contact tracing suspected cases, not just confirmed cases, whereas other countries didn't do that. But the excess debt figures produced by HICWA tell a lot. The fact that we may be one of the few countries significantly revising down the number of deaths during that period. For some people, they saw it as some sort of competition as to where they were in a league table. And there's really hateful, nasty stuff from people who thought that it was some sort of competition between countries. And when they saw Ireland high up in a league table, they almost took a perverse pleasure in that, because it was an opportunity to have a go at the government or Tony Hoolan or whatever. And I just deplore that kind of attitude and those kind of people, I must say, because they did nothing at all to help us when it came to fighting COVID.
Thank you, Tánaiste. Questions. We move now to questions on promised legislation. 30 deputies have so far indicated. It's a minute per question. So if you stick to that, we'll get through as many as possible. Deputy Pearse Doherty.
Tánaiste, you just told me earlier that the banks told you at the meeting of the 11th of May that they could waive interest on mortgages during the payment break, despite what the official minutes claim. Can you explain to me then why your former colleague Brian Hayes, who is now the chief lobbyist for the banks, stated clearly yesterday, defending the